My name is Patrick Rohan, CEO of Medical City Frisco, and I'm here with Lisa from our labor and delivery unit, and going to take a few quick minutes to talk about the unit itself, Lisa, the team here at Medical City Frisco, and give you a little bit of my perspective. So Lisa, good afternoon.
Hi, good afternoon.
How are you doing?
I'm great, thank you.
Well, good. Well, Lisa's actually been here since the start of our program, right?
I have. I started in December of 2018, so about a month and a half after opening.
Great. And you used to be at Medical City Plano before?
I was in labor and delivery at Medical City Plano for about 26 years.
Wow, well great. I mean, so a big time, member of the HCA family.
Yeah, I've been there since I started, yeah.
That's wonderful. And so I had some time to talk with Lisa for about an hour about the unit, our team. I got some great perspective on opportunities that we can help refine and improve the department. Some great ideas from Lisa of additional resources we can allocate to make their work life better, to give them additional tools to be more efficient, and to give overall better care and satisfaction to our patients that come to our labor and delivery unit. Lisa, what are some of the things you really enjoy about working here at Medical City Frisco?
I enjoy the teamwork. We have very tight-knit teamwork, very cohesive. Being a small unit, we rely heavily on each other to help each other out. And I think that speaks very loudly to our unit. And being another baby unit, labor and delivery, we incorporate another baby nurses, we have more nursing nurses here to help as well. And then obviously we have our NICU nurses too that can jump in and help. So I think the biggest thing I see that I find a huge positive is the wonderful teamwork we have.
Well, great. Well, I agree with you. The unit is very collaborative and cohesive, and I always see in practice everyone working together. And I know a lot of the times your team interacts with our operating room.
Yes.
And then there's a lot of, I think, cohesiveness approach to taking care of patients between the two departments there as well.
Yes, I agree. Because we do our scheduled cases, C-section cases downstairs in the main OR. So we utilize their OR, but we also have, if needed, we may have them help us with supplies or instruments if we need. So they're very helpful to accommodate and help us locate those, as well as assisting us with needs up here. That in our cases, if we need help from them, they're more than willing to come up and help find us something, bring us something. Sometimes help staff our unit with scrub techs as well. In addition,
that's great. I think they're an awesome team as well. And transitioning into the practice and why we do what we do. My mom was a nurse. I got to kind of grow up seeing her take care of others and give her time into improving the lives of people in her community. What drove you to get into this profession?
My story, I have a great story. My mother-in-law was a labor and delivery nurse at Medical City Dallas for about 35 years.
Yeah.
So she was my inspiration to becoming a nurse, and also my inspiration to becoming a labor and delivery nurse. I started off studying something totally different, marketing, met my husband, and she was finishing up nursing school. So I started, when I'd go over to their house, I would kind of look through her textbooks, and she would be studying, and decided that I thought this was nursing profession was something I wanted to do. Totally changed my major, went to nursing school. So I owe it all to her as my inspiration for becoming a nurse.
Well, that's great. Really look to family sometimes for our inspiration.
Yes.
Glad I kind of share that in common. And lastly, I will be not only a CEO of the hospital, but also a patient. Via my wife and I will be delivering our first baby exactly a month from today. So what's one word of advice you can give us as new parents coming into this world?
I think just be open-minded. You obviously have hospital experience being here in the hospital business. Be the dad. Be the dad. You're there to support your wife. Enjoy this experience. Becoming new parents together, and we are all about here patient satisfaction. We want your stay to be fabulous. We want a safe, healthy delivery, and for you to enjoy the entire stay here.
Well, great. I have no doubt we are in great hands with you, with the team here. We're very fortunate to to be coming here. I'm very happy about that. So thank you for your time. I appreciate
Absolutely.
you.
Thank you for allowing me to share my past, my story.
Well, great. Well, that'll be it for today. Thank you again, Lisa. Thank you everyone for listening, and more to come on Patrick's Perspective. Thank you.
Thank you.